Good evening, everyone, and thank you for joining myself, Corinne Carey, and Dr. Jeff for a webinar regarding advanced care planning during COVID-19. I'm going to allow another minute or two for participants to continue to log on, and we'll get started shortly. Good evening. We're going to go ahead and get started. Tonight, thank you for joining us for Advanced Care Planning during COVID-19. We hope to provide you some options, resources, and information around advanced care planning. I just want to let you know before we begin that this webinar will be recorded. However, if you ask any questions in the Q&A box or you are called upon to speak, it will not record those things. Additionally, there is a Q&A box on the bottom of your screen. If you click on that, you can type in any questions that you may have. There's also a button that you can press so you can send your question anonymously should you not want us to know who's asking the question. At the end of our presentation tonight, we will take some time to answer and have more of a discussion. Before we begin tonight, I would just like to take a moment to say thank you. We would like to thank Compassion and Choices would like to take a moment to say thank you to all of the frontline workers, essential staff, and especially lawmakers who've worked tirelessly to help New Yorkers during this unprecedented time. Additionally, CNC is often familiar to lawmakers and their staff as the organization that's trying to pass the Medical Aid in Dying Act. And although we would love for you to pass the Medical Aid in Dying Act, tonight we hope to provide you with some tools and resources that are helpful to your constituents and to those around you. During this evening's webinar, we will cover setting the stage and hearing from Dr. Jeff Gardier, who I will introduce in just a moment. Resources for advanced care planning. We'll have a bit of an interactive discussion, and then we'll take some questions and answers. But first, we'd like to take a quick poll of our participants. We'd like to know, have you done any of the following things? Designed a healthcare proxy, completed an advance directive, thought about the care that you'd want to receive if you had a COVID diagnosis, or maybe you've done more than one of those things. So if you could take a moment and participate in that poll, we would appreciate it. Alrighty, so it seems like the majority of people have thought about the care that they would want to receive if they had a COVID diagnosis. So hopefully by the end of this conversation, you'll know how to fill out documents to put those wishes in place to make sure that they in fact happen. Thanks for participating. Today's speakers are Dr. Jeff Gardier, who's also known as America's Psychologist, and Corinne Carey, our Senior Campaign Director at Compassion and Choices. Let's start by setting the stage. I am pleased to introduce Dr. Jeff. He is one of the most widely sought after experts in the field of mental health. In addition to having a private practice in Manhattan, he has an associate professor and course director of behavioral medicine at Touro College of Osteopathic Medicine in New York City. Dr. Jeff is also an ordained interfaith minister with a doctorate in divinity from the New Seminary. Dr. Jeff, better known as America's Psychologist, is also a prolific author of 4 books and a contributing author of a half dozen books, including the brand new text, The Causes of Autism. In addition to being a respected academician, Dr. Jeff has been a contributor to the Fox Network, The Today Show, MSNBC, and CNN. We're so grateful to be working with Dr. Jeff on making sure all New Yorkers have full access to a full range of options at the end of life. Dr. Jeff, you can take it away for us.
All right, thank you so very much. And thank you everyone for being with us today. This is an opportunity for us to address our state lawmakers and their staff on their timely subject of end-of-life care planning during the deadly COVID-19 crisis that we have all been experiencing. So before we get started, I wanted to echo the words of my colleague and thank all of you as our state legislators and your incredible staff that you work with every single day for doing the work that you do during COVID-19, like our medical personnel, our EMS, law enforcement, frontline and essential workers. You all are our new superheroes, and our nation really does turn its lonely eyes to you, and we thank you so very much. But don't forget, you may be superheroes, but you're not superhuman, and therefore it's important that even though you do the work on the ground that you've been doing, that you've taken these leadership roles, it's important to take care of yourselves also, okay? So as I like to say, if you talk the talk, you better walk the walk. And I know that we have some legislators from the New York area, especially some of them who are Haitian, just like me, sac passe. So I have to say to all of them and friends of the Haitian community, Haitian Flag Day to our legislators and their staffs. And I hope that you really are enjoying it. All right, so let's get started. Let's be real. We know that one day we are all going to die, right? That's it. That's the cold hard truth. But regardless of our age, this pandemic has made us all face our mortality perhaps sooner than we've wanted to or ever thought about, but like no other time in modern time in our lives. As a psychologist, I'm counseling patients remotely about this, the unprecedented stress in their lives. As an interfaith minister, I have prayed with them and talked about spirituality in getting them through this very difficult time. But I think we need to be honest about this. We're all up in the air as to what's going on, because we still can't completely comprehend what is happening with this particular virus, but we're doing our best. Not only that, we're dealing with depression, we're dealing with anxiety, we're dealing with PTSD, all mental health challenges that truly are the second wave of this pandemic. But as you know, some experts have stated that coming out of this pandemic may be just as hard, if not even harder, than the way that we went in. And the same financially, of course. And the same goes with regard to mental health. My patients, my clients have been emotionally distraught and rightly worried about whether we are opening our economy too soon. Why? Because they are the frontline workers that we talked about. They're the essential workers that we talked about. They are part of the secretarial staff that needs to be at the work site, even though those of us who have administrative or professional types of titles have gotten to stay home and be with our families. So they know that as people of color, as these frontline workers and essential workers and living in certain housing complexes and so on, they know that they are at a greater risk of both getting infected with COVID-19 and sadly dying from it. And this is due to the inequities in socioeconomics, in healthcare, in living conditions. We talked about, these large complexes of subsidized housing that people live in, but also the substandard nursing home care. Not everyone can afford the 5-star nursing homes, but even they have had to deal with COVID-19 in a very different way. And so we also know that as African Americans or people of color, Black and brown people, Latinos, we also have pre-existing health conditions which have come from all of these other factors that I've talked about. So we're talking about issues with diabetes, hypertension, and general heart conditions, and so many others. And then throw in there the double whammy of being an older person of color. So yes, many of the people that I've talked to are justifiably anxious about the very real possibility of care rationing, because that means a stranger, albeit a caring one, such as a nurse or a PA or an NP or a doctor, with the best intentions, know nothing about the patient's care wishes if there is not an advance directive. And so they decide who gets priority care, who doesn't, instead of the patient through that advance directive or a trusted health proxy. So to minimize the chances of this nightmare scenario, I urge you to work with your constituents to think about and complete an advance directive and name a healthcare proxy, to advise healthcare providers about end-of-life care preferences and values. And of course, especially for those, God forbid, who cannot speak for themselves. For example, if you're elderly and in bad health, or even terminally ill, you may not want to be intubated or put on a ventilator because it is excruciatingly painful. And the reality is you are very likely to die on that ventilator, as we've seen with the COVID-19 cases and people of advanced age. Or barely survive with severe organ damage throughout your body after being on the ventilator and suffer a horrific quality of life, end of life. And the usage of intubation and ventilation when it's not wanted, sometimes for weeks or even months on a patient, is a terrible burden on a human life. Now, we've all heard stories of doctors having to make decisions about the care they provide to unconscious patients because they didn't have an advance directive or a healthcare proxy to advise them of the patient's preferences. And I can tell you that it's a terrible stress to add to a doctor's already super stressed levels because they're taking on a life and death decision on a human being who has perhaps lived a very long and personal life, but who still is a stranger to that healthcare provider. I've counseled many physicians, and I'm actually married to one, and can tell you that these are the agonizing decisions they dread making because they know they've stepped into the role of decision-making that should only be made by someone who truly knows the patient. Or even better, following an advance directive that truly reflects the wishes and values of the patient and speaks in that person's voice as a reflection of a lifetime of experience. It's also extremely stressful for family members if you're hospitalized, if they have a family member who's hospitalized and there isn't an advance directive or healthcare proxy, especially during COVID-19, when they cannot be there to actually monitor what is going on with the loved one because of trying to stop the contagion of the virus. Regardless, even the closest loved ones may not know what is going on or what care that the patient may want because they cannot speak for themselves. But an advance directive allows that. Now, I'd like to tell you about 3 patients I've counseled since the COVID-19 crisis that may be a clear example of what I'm talking about. And of course, I've been working with so many patients starting from early in the morning, 6, 7 in the morning, and working till 8, 9 o'clock every night. One client of mine in her 50s, whose grandmother was in her 90s and lived in a nursing home, had no idea of what kind of care her grandmother received at the end of her life because of COVID-19, and she couldn't be there with her in the nursing home during her last days, being transferred to the hospital on that last day of life. And because her grandmother never completed an advanced care directive or named a health proxy, basically my client didn't know what was going on, and that added to the grief of the death of her grandmother. She's haunted by the fact that the doctors made all the decisions about what kind of care her grandmother received without any input from her granddaughter. In contrast, I have a 33-year-old client of mine who unfortunately contracted COVID-19. So yes, it does affect young people too. But this was a young African-American woman. She, however, had an advance directive and named her longtime boyfriend partner as her healthcare proxy. And he agreed to put her on a ventilator. She recovered, but still has physical and psychological health issues. Nonetheless, she's grateful to be alive and thankful she did have her advanced care planning. And she states that emotionally, before she even went into the hospital, before you even thought about getting her there, that she knew that if something took a wrong turn, at least she had her advanced care directive. And guess what? That advanced care directive, once she got out of the hospital, knowing that she had the control over her life has helped her recover even sooner. There are psychological benefits to the advanced care directive, not just the physical or purely medical. And then finally, another patient of mine in her 50s is glad that her 100-year-old mother who lived in a nursing home had an advanced directive. So she didn't have to worry about her healthcare providers giving her mom the care that she wanted. While there were COVID-19 cases in the nursing home, thankfully my client's mom died of natural causes. So in closing, as lawmakers and staff, you will be meeting with each other and your constituents in the very near future, especially as we come out of COVID-19. And I know you're talking to many of them on Zoom. Rodney's show, I know, has done so much there. Jamani Williams has done so much. All of you have done so much, and we thank you. But I strongly suggest that you work with your constituents and, of course, your constituents of color to complete and update their advanced directive and name a healthcare proxy. But do this ASAP. One of the things that we've learned from COVID-19 is that tomorrow is not guaranteed for any of us. So as this healthcare crisis vividly demonstrates, the last thing we want is to leave critical healthcare decisions just to the doctors. And it's important that we teach people to have a voice while they still have a voice, to have control while they still have control, so they can have control of the end of life's process. Now, I'd be happy to take any questions you have from Corinne or after Corinne's presentation about compassion and choices. COVID-19 toolkit, which is so amazing, so empowering, so powerful as part of the advanced care planning from A to Z. And remember this saying from the 50s, soup to nuts. So thank you so very much for your time.
Thank you so much, Dr. Jeff. We really appreciate it. Now, I would like to take a moment and introduce you to Corinne Carey. She is our campaign manager, or I'm sorry, she's the senior campaign director here in New York, also in New Jersey, and she is going to give you an update about all the tools that Compassion and Choices has to offer.
Fantastic. Amanda, thank you so much. If we could get the PowerPoint presentation back on that. There we go. Great. Thank you. Well, as Dr. Jeff said, dying is something that all of us experience. Some of us grow old and die surrounded by loved ones, and others' lives are cruelly cut short. If we could go to the next slide, please. A 2015 study published in the Journal of the American Society on Aging showed what most people think of as a peaceful death. They want to be at home with loved ones. They want to have their pain and their discomfort managed, their spiritual needs and values respected, and they don't want to be a devastating burden on their loved ones. Many of us have this image, many of us have this image of our deaths as laying in a clean bed, surrounded by our loved ones, maybe the grandchildren holding our hands with a soft breeze blowing through the window. In fact, how we die often looks much different from that. Next, please. Far too many people die in hospitals or other facilities, too often alone, and receiving treatment and care that they don't actually want, which is paradoxical at a time when we've been talking about rationing care. Next slide, please. The fact is, even though living wills have been recognized for decades, and most adults know what they are, studies have shown that more than 2/3 of American adults have not completed an advance directive at all. And in one study done out of the University of Pennsylvania, researchers found that the treatments that most Americans would want near the end of their lives are often very different from the treatments that they receive. I want to talk a little bit about advanced care planning documents that are available in New York State. Every state is slightly different in the documents that they recognize and want you to have filled out. In New York, there are 3 different kinds of advance directives. A living will that really sets out the kind of care that you want to receive. A healthcare proxy designation, which allows you to choose the person who will speak for you when you no longer have the ability to do so yourself. And what's called a DNR, or a do not resuscitate order, which is an order that's put in place to let someone know if you want to be resuscitated should you lose the ability to breathe. You know, a lot of times I talk to people out in the community, elders, people with compromised immune systems, and I ask them about advanced care planning, and so many of them say, oh, I know, I have a DNR. A DNR is for a very small subset of people who really are facing the end of their lives. A DNR is not what an otherwise healthy person would want to have in place to let people know the care that they want to receive should they lose the ability. So for example, if you are struck with COVID-19. A DNR is probably not the right document to have in place unless you have underlying medical conditions that signify that you're at the end of life. It's really an advance directive. It's what you want laid out in your living will, and it's the conversations that you have with your healthcare proxy that are important. Another document that I want to mention here is the Medical Order for Life-Sustaining Treatment, or the MOST form. Now the MOST form is called a POST, or a physician order for life-sustaining treatment, and now many states are calling it a portable order for life-sustaining treatment that is put in place with your doctor. So this is not something that you do on your own, it's something that you do with your doctor. Next slide, please. Now, I talked about the importance of designating a healthcare proxy. Here in New York, it used to be several years ago that if you didn't have a healthcare proxy, it was really unclear who could make those decisions for you. And oftentimes a healthcare provider was left making the decision. Very wisely, and after much advocacy, the New York State Legislature passed the Family Healthcare Decisions Act in 2010. And that legislation sets forth, in order of priority, the people that can act as a surrogate decision maker for someone who loses the capacity to make decisions for themselves. That law first looks for a court-appointed guardian, then it looks to a spouse or a domestic partner, then an adult child, a parent, a brother or a sister, and a close friend. So there's a whole list of people that can be designated to make your decisions. But better than leaving it to these preordained categories, you should choose someone for yourself. It may be that your spouse or domestic partner doesn't know your values, or may not share them, and may not act with your wishes in mind. Same with an adult child. I hear from so many people that they have 2 children and they would choose, they would trust one of them with the decision, but not another. So it's really important that you figure out who will carry out your wishes and then have the conversation with them. Next slide, please. I want to talk about the tools that are available to you. And we have an incredible resource in the New York State Attorney General. The forms that I just mentioned, the living will, the healthcare proxy designation, all of these documents can be found in a resource from the New York State Attorney General. On their website, they have these forms that you can fill out, go back one, that you can fill out, and they even have a wallet card to show who your medical proxy is. So I would, if you're interested in these resources, head on over to the New York State Attorney General's website and download some of these forms. But forms are forms, and they are intimidating for people. You can take out a pen and fill them out, but how do you think about your wishes and your values at the end of life? And that's where Compassion and Choices comes in. We have a section on our website dedicated to helping people plan for the care that they want at the end of their lives. So our resource center is available, and you see the landing page here. Next slide, please. This has a whole host of resources in English and in Spanish to help people finish their lives in a strong way. We call it Finishing Strong, after a book that was written by Barbara Coombs-Lee, our president emeritus. So Tools to Finish Strong gives people with life-threatening illnesses the support and the opportunity and the courage to live their life to the fullest, even as illness advances. And I'm going to go through some of these resources with you here so that you know about them and you can share them with your constituents. So again, here is Barbara Coombs-Lee's book. It's available on Amazon and on Audible, Finish Strong, Putting Your Priorities First at Life's End. In this resource center, you can find tools to plan your care. You can find tools about planning for the care that you want should a diagnosis of dementia or Alzheimer's be something that you're contending with. And you can also find tools for how to decode your diagnosis when talking to your doctor in the case of a serious illness. Next slide, please. So I'm going to go through each of these, the end-of-life decisions guide and toolkit, all the way through to our doctor-to-doctor consultation program, which allows your physician, if they have questions about end-of-life care, to reach out to experienced physicians from across the country and talk to them about how to deliver the best possible quality end-of-life care. Next slide, please. As I mentioned, all of these resources are available in Spanish, as well as our hotline. People who speak English or Spanish can call our hotline to ask for information about resources in your area, hospices, palliative care, and I would encourage you to pass on these resources to your constituents. Next slide, please. This is a booklet that is available. We can mail it to you, or it's available online. It's available in both English and in Spanish. It allows people to go through all of the planning process of thinking about what they value most out of life. What kinds of care do they want calibrated towards the values that they hold at the end of life. So this is a tremendous resource that is available in hard copy that we can provide to your constituents. Next slide, please. The guide goes through putting your priorities on paper, how to do your advance directive, what you want in terms of life-sustaining measures, what documents are available that help you spell out those choices for your healthcare provider and your health proxy, how you make that decision about choosing the representative who will speak for you, and then how to talk to your provider, ensuring that medical providers actually honor your wishes once you've set them out. And then how do you make sure that people know that these wishes are expressed by you? Many people say, yes, I've completed an advance directive and it's in my safe, or it's in my file cabinet. Well, that's not helpful if you are taken to the hospital in an emergency. So there's a whole section of this about how you can make your wishes known in a way that's more dynamic and more useful than having a document that's filed away. Next slide, please. As Dr. Jeff said, once COVID-19 shut down our legislative campaign in New York and legislative campaigns across the country, we really turned our attention to how we could adapt some of these tools to fit the moment. We knew that people had a tremendous number of questions about their own risk in encountering the healthcare system, what their options were for hospice and palliative care during this very precarious time. What does it look like when an illness hits so quickly? How do you do advanced care planning? And then how can you be sure that your wishes are respected by healthcare providers in this accelerated time frame of a COVID-19 diagnosis? And so next slide, please. We put together a whole set of tools to help people. So in terms of reducing the risk of encountering healthcare professionals in the healthcare system, we did a tremendous amount of work to encourage states and the federal government to expand the use of telehealth. And this resource actually teaches patients how to access telehealth to reduce their risk. Click, please. We also put together a document about understanding your options for people who are most affected by coronavirus. And it actually turns out that everyone is affected by it. I myself was sick for about 3 weeks with the virus. So it does not discriminate, although it hits everyone in a different way, as we absolutely know. And I just want to give a shout out to Lawmakers for holding an incredible hearing this morning in New York about the impact of COVID-19 on communities of color. So people often say we're in the same boat. We're definitely not in the same boat. We're all dealing with the same pandemic, different boats on different rough seas. So at any rate, this resource is for people to understand what their options are during this pandemic. Next, click please. And then finally, what does it look like to die in the age of the pandemic? I'm sure we've all seen people dying alone in hospitals, maybe doing Zoom calls with relatives from a hospital bed. People are really concerned about whether they can die at home. Can they get pain and symptom management from home and avoid going into the hospital and dying alone? And just a shout out to healthcare providers. People weren't necessarily dying alone. There were loving healthcare providers with them, but they weren't with their families. And this is something that our supporters definitely wanted to avoid, is dying in a hospital. Next slide, please. The other thing that we did is we put together an addendum for your living will that allows you to make some decisions about the kind of care that you want in the wake of a COVID-19 diagnosis. So that addendum allows you to address questions like, if your oxygen levels are dropping, do you want to go to the hospital, or would you prefer getting non-invasive respiratory care at home? If that care is available to you at home, it can keep you comfortable, but it can't save your life. Do you want to stay at home, or do you want to go to the hospital? There are, and you can go to the next slide, please. There are a number of questions that this addendum addresses, and I encourage all of you to take a look at it, print it out. I know that the majority of you on the call said that you've already given some thought to the kind of care that you want, but this addendum helps you think through all the different eventualities that could face you if you have a COVID-19 diagnosis. Next slide, please. All of these resources, of course, are also available in Spanish. I just want to make sure that you know that. Next slide, please. So what about dementia? One of the things that I hear most often when I'm out in the community talking about end-of-life options is, what happens if I have a dementia diagnosis or I'm diagnosed with Alzheimer's? And these are difficult questions, and I am so grateful to Compassion and Choices for putting together a whole suite of new tools, and I'm going to talk you through these as well. If you're like me, many people, next slide please, have someone in their life that's dealing with a dementia diagnosis, and it is scary. It's something that people don't really know how to talk about in advance, and up until recently, there wasn't a whole lot you could do. These diagnoses can be devastating, but documenting your preferences can help you make sure that you get the care that's consistent with your values and priorities, even with that kind of a diagnosis. This tool on our website allows you, next slide please, to go through what kind of care you want or how you can help a loved one. So as you can see on this screen, one of the first screens that you'll see through this tool is, have you been diagnosed with dementia, or are you someone who is thinking about making your wishes known for the future? And then I'm not going to go through all of these. It's a fascinating tool, but basically what it does is it asks you a series of questions. So for example, I have forgotten everything about my past, but I still recognize those closest to me. And then it gives you the ability to designate what kind of care you want should that happen to you. And you can see the button at the bottom. Sorry, go back one more. You can see the button at the bottom. It allows you to explore further what those levels of care mean. And you can skip any questions. This doesn't apply to me. I don't care about this. And then once you're done going through all of those questions and specifying the kind of care that you want, you can print out the document and have it along with your living will, so that your care providers will see that you've done this advanced thinking about the kind of care that you want. Next slide, please. So that's our dementia tool, which again, I've gone through it for my own family. It's incredibly helpful. Another tool that we have on our website is about what happens when you get a serious diagnosis. How do you think about that? How do you talk to your physician about that? So we have a whole set of tools about getting more out of your doctor's visit. You can choose the kind of care appointment that you're planning to go to. Are you going for a general illness or something that you're not sure what the diagnosis is? How do you prepare for that upcoming appointment? What questions can you ask? Are you going for cancer care? How can you prepare for that visit and ask the kinds of questions that you need to of a cancer care provider? Or are you going in to talk to a physician about dementia? So that's a really helpful tool on our website as well. Next slide, please. And then finally, as I mentioned earlier, we have a doctor-to-doctor consultation program. We've got online tools, next slide, and we've also got a number that doctors can call to speak with an experienced physician about delivering quality end-of-life care. So I know I went through all of those resources quickly. I want to have some time for Dr. Jeff and I to have some discussion, but I want to encourage you, if this is of interest to you, if you found these tools fascinating, helpful, if you think they might be helpful in your district, please ask us. If you want more information or specific information, request a speaker. We would love to come out to your district and do a town hall with some of these documents in hand as a service to you and your constituents. So thank you. I want to turn it back to Dr. Jeff and have a little bit of a conversation before we open it up for questions. Dr. Jeff,
Yes.
Why do you think people find it so difficult to talk about death and dying and planning ahead?
Well, that's a great question. And, what I think is going on is certainly none of us think that death and dying applies to us, or that it happens so far into the future that we don't need to think about it. We are really more caught up than anything else with living just for today. But I think what we've learned is we do have to plan for the future. The other thing, Corinne, that I think is important is that for many people, they are of the mindset that it has to be something that is really awful. Death and dying is something that we don't want to talk about. It's bad news. It's about not having a sense of power. But what we really do find out is that it doesn't have to be scary. It doesn't have to be something that's ominous. It could be part of that pattern of life. We come into the world and we leave the world. So I think one of the best things that we can do in speaking with people about death and dying is to not look at it with dread, but look at it as an important part of the pattern of life, of the story of life. So having an advance directive also gives them that power, that locus of control that they are afraid that they're not going to get. So the advance directive tells them that they can have control over their lives even at the end of life, that they don't have to have unnecessary treatment, that they don't have to have unnecessary pain, that they can take that part of their life in a way that they are able to have some control over. And so once we have those conversations about the power of the advance directive, all of a sudden, it's not such a scary thing anymore to think about death and dying, and we can actually give it the respect and deal with it as part of something that none of us can escape, but something that we should embrace as part of a life that is well lived.
You know, the pandemic hit communities of color really hard. And I know that the legislature is looking at those issues. I think we'll need a little bit of time to look at how things went so terribly wrong. But I wonder if there's anything you think advanced care planning could have done to make it less terrible for individuals who are caught up in these really hard decisions.
Well, as I talked about in my opening talk, as you've talked about with the tools that are out there, when we don't have the advance directive, certainly we are in a situation where we are a victim to everything and everyone else. Who really does represent us at this point better than our own voices? And I think that's part of what happened here. With COVID-19, the people who had the advance directive did better as far as having control over the kind of treatment they received or did not receive that they opted out of. But the ones who didn't have the advance directive suffered even more. And we're talking about African Americans, Latinos, and so on. We've seen that they have been more at risk for COVID-19. Part of that, of course, as we talked about, the housing that they may be in. But the biggest part of that, the healthcare disparities. And healthcare disparities have affected us in so many ways that have contributed to a lot of our pre-existing conditions where we have not gotten the proper medical care that other people seem to get that we don't get, those of us who are of color. And a healthcare disparity that we don't talk about is not just about the inadequate medical care, but it's also not getting the information about having an advance directive or advanced directive planning and care. And so that's why I think we suffered even more during COVID-19 because we didn't have that tool. So again, with our legislators, with the staff that they work with, it's important that we speak to our constituents about leveling the playing field when it comes to this particular health care disparity of not having an advance directive. We tend to have them much less in colors of community. Many of us don't know enough about hospice care and pain management. So there's all of this unnecessary suffering, but our legislators can correct that by making it their mission to go out and work with people of color, to work with Latinos, to work with all of their constituencies, but also to work with this underserved community who have this healthcare disparity of not having the information, the momentum, the information of having the importance of having an advanced care directive.
You know, I was speaking with one woman who told me that when her mother's doctor said that her mother had an advanced care plan that said that she didn't want antibiotics should she develop an infection, the doctor said, you know, she was likely to die within days. This is a woman who had been languishing unhappily with a dementia diagnosis. This woman said that she felt like she had been given a gift by her mother because she wasn't being called on to make the decision. Her mother had already made the decision. Do you think that creating a plan for the care that you want at the end of your life can have positive mental health effects for loved ones who experience the passing of someone dear to them?
Absolutely and totally. And let me not sugarcoat it and say absolutely and totally. I'm being facetious, but yes, absolutely. I've talked to so many family members when I was up in Albany with you and we were talking to our incredible legislators who were there with us. I was talking to some family members of some of the constituents to our lawmakers. I've talked to some people on the Black and Puerto Rican legislative weekend, talked to so many of those family members who said, when the doctors came to us and asked us, what did we want to do? Our parent, our mom, our dad, our loved one was on life support. At that point, it was futile. They were not going to survive. It was only a matter of time. And therefore, they asked the family members, well, what do you want to do? If the family members made the decision of, okay, let's go ahead and pull them off life support, they felt extremely guilty about that because they don't know if that's what that parent really wanted. They didn't want to have that kind of decision living on in their minds for years after. If they said, no, keep them on life support, even though it's futile, what happened? They felt so guilty about that because, again, they didn't know what that parent would have wanted if they had that voice, if they had that advance directive, and therefore they felt guilty about that for years to come. And so they were in the emotional pain of being between a rock and a hard place because it was damned if they did and damned if they didn't, right? So when you have the advance directive and you have the voice of that person, even though they can no longer speak or can no longer think, at least we know what it is that that person wanted when they were cogent, when they were conscious, when they were able to make that decision. And therefore, that burden didn't have to be placed on the family, which they then agonized over for years and years and years with terrible, terrible feelings of guilt.
Yeah. Thank you. This was a really helpful discussion for me. Amanda, do we have any questions from the audience?
And Corinne, thank you for an incredible presentation too. Thank you. That was so informative. I'm always learning more and more, every time you speak.
It's mutual. Amanda, any questions from the audience?
So I don't see any questions at this time. Remember, there's a Q&A box at the bottom of the screen, and you can check the box to send anonymously if you don't want to let us know that you're the one asking the question, but certainly feel free to pop in any questions that you might have.
I think, Amanda, maybe I'll talk a little bit about our advocacy efforts, and then you can, pop in and let me know if we have a question. How about that?
Sure. So, well, first let me ask this question. So we have a minister, another additional minister on, who wants to know that since we can't have any public meetings for some times, how can we get this webinar to others?
There will be a recording of this webinar on our website. In fact, we have a whole series of webinars that we've started since we've all been in lockdown. It's called Staying Stronger Together. And we have done, Amanda, I think a dozen webinars now on so many different topics. Really, really fascinating stuff. Dr. Ben Chavis from the NAA, the former head of the NAACP, was on one of them. Diane Rehm has joined us for a webinar. They're really worth checking out. So the recording from this one will be up online within the next few days.
Okay, and if you want to go ahead and talk about the other advocacy efforts.
Sure. Can you put the webinar back up? Great. We've been doing a lot of advocacy during this pandemic. The legislative campaign that we've been working on for 5 years has been sort of put on hold. But in the meantime, we worked with our ally organization, End of Life Choices New York, to help extend an executive order that they obtained that allows for remote witnessing of advanced planning documents. So when you are thinking about putting these advanced planning documents into place, you actually need a witness. How do you have a witness when you have to stay 6 feet away and stay in your home? So the executive order that Governor Cuomo signed allows for remote witnessing of advanced directives, and we helped End of Life Choices get that advanced directive extended through June 6th. Next slide, please. We're also going to be supporting a bill introduced by Senator Benjamin, who is looking to codify a number of the remote processes put in place through these executive orders. And so Section 9 through 13 of that bill in particular would permanently codify the remote witnessing process implemented in the executive order that I just talked about. Another thing that we've been working really hard on is
I would say this, when it comes to the witness situation,
yeah.
you can get them now remotely. At least you won't have anyone else saying, "Can I get a witness?" Yes.
Much needed humor in these times. Thank you, Dr. Jeff. So on to something less pleasant. The Centers for Medicare and Medicaid Services took a number of actions during this period to lighten the burden for hospitals. Hospitals were looking at CMS to reduce some of the regulatory requirements that they need to comply with during this time. And unfortunately, one of the things that they did was waive provisions of the 1990 Patient Self-Determination Act, which basically requires that healthcare facilities and hospitals inform patients of their right to accept or refuse treatment. So with this waiver, hospitals and healthcare facilities are no longer required to inform their patients of the right to accept or refuse medical treatment. And this leaves patients uninformed and at the mercy of the hospital. So we are urging CMS to reverse that one piece of the burden reduction that they sought to give hospitals and put that provision back in place so that patients know what their rights are in terms of the care that they want to receive. So those are the kinds of things that we've been doing. I want to give a shout out to our ally, End of Life Choices New York. They just launched a fantastic program with the Completed Life Initiative to help first responders and essential workers in New York to complete their healthcare proxy documents. And so they're doing some incredible work, and we look forward to working with them, hopefully in the future on this initiative. I want to share, Amanda, do we have any questions, or should I just go on to resources? Great. So I want to share with you some additional resources. As I mentioned, we have our end-of-life care planning resource center, our tools to finish strong, our phone consultation service. We also answer questions by email. You can email us at EOLC, which is End of Life Choices, EOLC, End of Life Consultation at compassionatechoices.org. This is a full listing of our COVID-19 toolkit, and you can find all of these resources and more at compassionatechoices.org/end-of-life-planning, and a number of other different portals through our website. Next slide, please. We have a number of upcoming webinars. As I mentioned, we've done about 12 already. The next ones on deck are Thursday, May 21st, this coming Thursday from 5 to 6 p.m. Eastern Time. We'll be talking about medical aid in dying in states that have authorized the practice, and how we're ensuring that terminally ill people can access the law. And that's part 2 of a 2-part series looking at medical aid in dying across the country. On Tuesday, May 26th, we're going to be talking about engaging communities of color and ensuring that all Americans are prepared for the inevitable end of life. And that'll also be from 5 to 6 p.m. Eastern Time on Tuesday, May 26th. On June 1st, Monday, June 1st, we're going to be doing another webinar for you, lawmakers in New York, and your staff and constituents. This is about understanding options and resources specifically about New York's Medical Aid in Dying Act. Look, it's really difficult to talk about death and dying. It's really difficult to talk about the idea of passing this legislation in 2020, but we've got terminally ill New Yorkers who are asking us every day if this bill will become a law in 2020. What we want to do on June 1st is demystify what this bill is. We know that there are fears, we know that there are concerns, and we want to allay them. We want to provide you with the facts about what this bill does and what it doesn't do. And so that'll be Monday, June 1st from 4 to 5 p.m. Then finally, not finally, because there are webinars every week for the foreseeable future, but then the next one after June 1st is Tuesday, June 2nd, looking really a deep dive into the opportunities to expand telehealth use amid the COVID-19 pandemic. You can learn more about all of these webinars, past webinars at compassionandchoices.org/webinar series. And the next slide will show you all of the previous webinars. You can find recordings from all of those webinars on that website. Amanda, do we have any questions or should we move on? Okay, well, I think we answered all the questions. You can follow us on social media. We are active on Twitter, Facebook, YouTube, Instagram. Someday we might be on TikTok. I don't know when that'll be, but Compassion and Choices has an account on Twitter. That's where you'll find some of the best new materials on end-of-life issues. Kim Callanan, our executive director, is also a prolific tweeter, as am I. You can follow Kim at Kim Callanan or me at Corinne Carey on Twitter. And you can look for us on Facebook and YouTube as well. Next slide, please. I just want to thank all of you for giving us an hour of your time this evening. I'm really looking forward to working with you in the future, to seeing you on the June 1st webinar about medical aid in dying, and hopefully to responding to your requests for a speaker in your district so that we can come out and talk to your constituents about the importance of these tools and the resources that are available to help them think through their wishes and values for life's inevitable end. Thank you.
And Corinne?
Yes.
Before we go, a quick, if I can implore our legislators, but also the people who are watching this, who may not be legislators. One of the things that we've learned during COVID-19 is who we really are interpersonally as individuals and as families. And one of the things that we do know is that we haven't had the discussions and the intimacy with our family as to what our thoughts have been, you know, who or what we want in our lives later on. Use this time that we're home with our families to have a talk about advance directive, having an advance directive. Use the time to explore death and dying conversations with your family. You have all the time in the world right now, but maybe you don't have all the time that you think you need, as we've seen with COVID-19. And also take the time, now that you're all becoming so proficient being online, which is our lifeline, to go check out our resources, our toolkits, and so on, and fill out some of those forms as part of putting together your advance directive. Now is the time.
Amanda, thank you so much for moderating this fantastic webinar. And Dr. Jeff, thank you. I learned something new. I'm inspired every time I talk to you, and I know that people who are listening were as well. Thank you.
Thank you.
Thank you so much, all. I hope you have a great evening. God bless you, and we look forward to hopefully seeing you in just a couple weeks on our June 1st webinar.